Okay, hi everybody. Dr. Katie Millang here from Stratton Chiropractic and Family Health Center, and I'm going to talk about acupuncture. Okay, what is it? It is ancient Chinese medicine and holistic treatment, and it originated over 4,000 years ago. So it's been around a really long time. It's based on the thought that health is a constantly changing flow of energy. And that energy is called qi. So qi flows through 14 channels along both sides of the body. And these channels are what we call meridians. So each organ that you have has a channel or a meridian. So your lungs, your heart, gallbladder, stomach, all of your organs have a channel. And we use tiny hair-thin needles placed along those meridians into points that help return energy and restore balance to your body. So this is going to stimulate your body's internal healing mechanisms. It can help with pain control, helps reduce inflammation, and balancing hormones. So you might wonder, okay, well, who needs acupuncture? And the answer is everybody. So we're all humans, right? And we are constantly dealing with stress. That can be physical stresses, chemical stresses, or emotional stresses. So, and those stresses can really take a toll on our body and affect us. So then our body starts manifesting those stressors into symptoms. Symptoms like fatigue, pain, trouble sleeping, anxiety, things like that. So we all want to be balanced and have a good flow of energy. Okay, so how do I know what points I'm going to use? There are 4 different ways of diagnosing and deciding what points we're going to use. Interrogation is just kind of taking, your complaint and what's going on with you and your body and determining the points that way. So there's lots of patterns and protocols that we use specific to things like that. Also, you can use palpation. So that is just feeling along certain points in all the channels and determining if that is tender. So then we know that point specifically or that channel, needs some attention. You can also use pulse. So we check your pulse on both sides and feel if it's rapid or slow, thready or faint, and those kinds of things, show imbalances and will help us decide what we want to do. And then what we mostly use is tongue diagnosis. So, kind of weird, right? Whoa, sorry about that. Okay, so I'm going to look at your tongue. I'm going to look at the color, the shape, the appearance of it, and the coating. And then we're going to really look into the relationships that it has with the internal organs. So just like all your organs have a channel, it corresponds with an area on your tongue. So if you look at the chart, you see that the tip of the tongue here is heart, and then right behind it is lung. So if you have some discrepancy or some color change or some weird stuff going on the tip of the tongue, then we know that the heart channel really needs some attention. Same with, the size of the tongue. So it could be gallbladder or liver that's having some imbalance there. So that imbalance can either be an excess of energy that we want to push somewhere else, or a deficiency of energy that we really want to bring energy to that point. So it kind of depends on what's going on and what we see. Okay, move me over here. All right, so what to expect? So you're going to come in our office and we're going to take you to the acupuncture room and we're going to talk. We're going to have a consultation and decide, what's going on and what you want to address. And then we're going to look at your tongue. I'm going to see what's going on in the tongue. It's kind of crazy. You don't want me to look at your tongue, but it really helps me determine what I need to do and what points I'm going to use. And then treatment begins. Okay, so I'm going to show you the needle. Oh, but before we needle, we use an alcohol pad to wipe down all the points. That's just going to make sure that it's a clean area before we insert the needle. So here's the needle. Teeny tiny little needle. You can barely see it. Okay, and then I use the tube. So I just put the tube on the point that I am going to put it, and I thread the needle into the tube, and then I just tap it right in. Oh, you couldn't really see that. Let's try again. Okay. Tap. Okay, so it doesn't go in very far. And we leave them for 12 to 15 minutes. That 12 to 15 minutes is one cycle of energy through your body. So we want to make sure that we get at least 12 minutes to, get through that cycle and kind of balance everything out. All right, so we talked about how everybody needs acupuncture. But here's a list of some common ailments that we treat and that people come in for acupuncture. Lots of sinusitis right now with the weather change and the rain and allergies and sinus pressure. So, we can help with that. Lots of anxiety and stress, lots of pain, sports injuries, infertility. So any of these things on here, if you see something that relates to you, then you're definitely going to want to try acupuncture. Okay. We're going to move on to some frequently asked questions. I'm just going to set these down. Okay, does it hurt? Sometimes you will feel a little pinch just when the needle's inserted, but not always. And sometimes you don't even feel them at all. It's kind of crazy because they're so small and they don't go in very far. So a lot of times you won't, even notice that I inserted the needle. And it should not continue to, if there is a pinch, it should not continue to be painful, and it shouldn't be a stressful situation. It should actually be pretty relaxing. Okay, so if it doesn't hurt, what does it feel like? This kind of varies from person to person and what points we're using. Sometimes you'll feel some tingling or a buzz. Sometimes you'll just feel pressure or heaviness in that area. Sometimes it feels cold, and sometimes you're just really relaxed. So it kind of depends on what's going on and what points we're using. All right, and then what do I feel like afterwards? So again, this is going to vary from patient to patient. Some feel very relaxed. Some have, added energy, a little more pep in their step, and some express a little sleepiness or tiredness and really want to go home and relax or go to bed early. Okay. How many times do I have to come, or how many times should I come? So we usually start with one treatment per week for 3 weeks. This is enough time to really get things balanced out and see how your body responds to it. So from there, it kind of depends. So we have people come for season change. That's a really important time to get acupuncture because the season is changing. So that means, changes in weather, changes in stressors, all of those things. So that's a good time to come in. And then symptoms. So if you are being treated for headaches and you're doing really well and we don't need to see you for a while, and then your headaches come back, well, then we obviously know that you need to get back in here and get acupuncture again and get those headaches taken care of. All right. So I rambled on a whole bunch, and there's probably a lot more questions you have, but take home's really important. Acupuncture is incredibly safe, effective, and painless, and it's going to help improve your overall health and your overall function of your body. And this month, we're celebrating our 20th, this year we're celebrating our 20th year anniversary. And this month, you get a free t-shirt with every acupuncture session. So you still have some time to get in here before March is over and get a free t-shirt. And they're really cool. So you can check the Facebook page for a picture of that t-shirt. Okay, and I think that's about it. If you have any, burning questions or more questions, or you've been considering acupuncture, reach out to us. Shoot us an email, give us a call, set up a consultation with the front desk, and we can sit down and, discuss everything and our options and determine if acupuncture is something that, you'd like to try for what's going on. And like our t-shirts say, yes, acupuncture helps with that. So I'm glad I got to talk to you guys. Feel free to share this video and comment any questions or call us or email us. Have a good night.